Let me begin by thanking my friend Dr. Jean Liu for joining me. Jean has worked as an ENT for nearly 14 years at Cedars-Sinai Medical Center in Los Angeles, and he also serves as the president of Cedars-Sinai Medical Group. He's considered to be one of the top ENTs in the world and gives everything he has and then some to as a creative thinker and leader as the president. We were just together in LA a few weeks ago, and before all the stay-at-home orders came and started coming in, and we had a little dinner, but I certainly didn't think it would go from that to him working nonstop at the hospital. I'm so proud to consider Gene my friend because I seriously don't understand how he finds the time to do anything but work. So with that, I'd like to say, hi, Gene. Thanks to you again for joining me.
No, it's absolutely my pleasure to be here. To be honest, it is a little bit of a welcome distraction from all the day-to-day COVID response that we've been all consumed by. So I consider it an honor and a privilege to be here.
Great. Well, first, let me ask you, first most important thing, how are things with you and Edna and the kids?
Everybody's great. The world has changed dramatically over the last month or so, as you well know. When the Surgeon General first announced that we should cancel all elective surgeries, and Governor Newsom and Mayor Garcetti in Los Angeles, California, started with the closing of the schools, the social distancing, and a few days later, the safer at home. Obviously, those were some huge changes in a very short amount of time to our day-to-day life. At that same time, we were completely revamping our entire health system to prepare for and respond to the anticipated coming surge related to the SARS-CoV-2 virus or COVID-19 disease. So that first week was really all fast and furious. In helping to inform our response, I also kind of jumped into the front lines of helping out in our COVID clinic and also helping our urgent cares completely redesign. In putting myself into that position, I felt it was necessary, number one, to really just understand what's happening in the front lines, and number two, if it ever came time to have a call to action or to ask people to step up, I felt like I needed to have done it already myself. And given that kind of, let's say, high risk environment, I basically moved out of the house. I went to a friend's apartment where she was kind of hunkered down with some other people. So I went into an apartment myself just to take away the stress and anxiety of possibly being a source of infection for my family, right? So that was really stressful at the beginning, but thankfully everybody's been healthy, everybody's been happy, nobody's had any symptoms, but it obviously is a big change in our lifestyle. So.
Absolutely. And for those of the people watching don't know, she's quite an accomplished physician in her own right and an entrepreneur to boot. So I'm sure this is probably driving her a little crazy just being stuck at home all the time.
Absolutely. You know, her anesthesia practice is really based more in the kind of surgery center outpatient setting. And with all of the elective surgeries being canceled, she had the luxury of not having to work for a little while, but also it's so unnatural for her not to work that it did add a lot of stress.
Now, you personally, how are you doing? How are you feeling physically, emotionally? How is, I know you're always that positive guy who's always going to put the best out there, but I'm sure it's got to be taking some toll.
You know, certainly my natural response to almost anything is to throw myself in and stay busy. That's almost my defense mechanism, if you will. And so for that first week, it really was so busy that really didn't have time to think about it. And I think the biggest source of stress was not knowing when the tidal wave was going to hit, how big it was going to be. Are we going to be prepared enough? Are we going to turn into New York or Italy? And I think the stress really caught up with me about a week and a half into it, when we had done the frantic work of getting ready, and then the tsunami didn't hit, right? And we were seeing COVID patients. It was getting busier, but it was manageable. And all of a sudden, I felt like I had a little bit more time on my hands to almost stop and kind of take it in a little bit. And then the reality set in of, okay, I haven't been home and I haven't seen my family in over a week. Um, since that time, things have actually settled down again, right? So we haven't been overwhelmed in LA. We haven't been overwhelmed at Cedars-Sinai. I think we've prepared beautifully as a health system, as a city, and as a state. And all of our kind of early frantic preparations, I think, have really paid off. And I'm very proud of uh, where we are. And that's taken away a lot of that stress. So I think it really was that uncertainty at the beginning that really um, made it difficult, and especially combined with all of the horror stories we were hearing from our friends and colleagues in areas that were very hard hit.
So that explains a lot. It actually went into my next question because, yeah, we keep hearing on television, that LA was going to be an epicenter as well, and it was going to have the same kind of uh, things happening as New York City has, and you all have remained, it seems like, a very controllable situation. Um, do you think it's just a combination of the things that the people in the city were ready to do this quicker than maybe people in other parts of the country, and the medical preparedness by hospitals like y'all, or do you think it's one or the other more than the other, or do you think it's the governor's orders, or what's your overall thought?
Certainly, there are a lot of theories as to why it played out differently. I think some of them would seem to make obvious sense. So when you look at New York, a lot of people taking packed subway trains everywhere, living in high rises, getting into elevators, touching the same buttons. We really don't have that population density and really that lifestyle here in California and LA. We tend to go into our own cars, right, in a hermetically sealed box, and you drive to work and home. Um, if you live in a building, they're not nearly as big. There are a lot more little walk-ups, and you're not packed in the same way. In addition, New York seemed to be about 6 to 12 days ahead of us in the course of the pandemic. And LA and California went to closing schools and locking down, or being, we'll call it, safer at home, about 5 or 6 days before New York. So in the course of the pandemic, we really locked down somewhere between, let's say, 10 and 20 some days earlier. Mm-hmm. And I think that makes a huge difference in a disease process that seems to grow exponentially, right? So when you lock down that much earlier, you really do have a much better chance of flattening the curve and not getting overrun. So I think the biggest difference was the mayor and the governor really being that much more proactive. The response of the health system, as soon as that, I think, second or third week in March hit, we shut down elective surgeries pretty much immediately. We completely closed down almost all of our physical offices and converted much of what we do to telehealth and video visits. We redesigned our urgent cares to be a respiratory and non-respiratory side. With all of those changes, we made huge, inroads into developing processes and conserving all of the equipment that we thought we would need, and not burning through resources and keeping our hospitals full. So we created so much capacity even within that first week, of hospital beds, of ventilators, of personal protective equipment, and really allowing people to protect themselves and be a viable workforce when the surge hit. And I don't think New York ever had that luxury. But all of that didn't change how many people got sick with COVID in the city, right? That affected how well we would be able to respond to it. I think the city and the state response really drove how well we're doing.
That's great. When I was there a few weeks ago, everything still was hopping and busy, and there's still people kind of everywhere on the streets. Does it seem very eerie right now?
Um, Absolutely. What I love about it and what everyone loves is you go anywhere in LA right now, there's no traffic. Like it's surreal, but that's the one good benefit. I mean, air quality is better. Um, the downside, obviously, is um, being hunkered down. It can be not just physically distant, but socially distant. So there are a lot of people who, especially if they don't have as much of a social network or a network of people to help out, it can be very isolating, which can have huge consequences in physical and emotional well-being, kind of physical health. But as far as getting around the city, gosh, if traffic could always be like this, I'd love it.
So there is a little silver lining. That's good.
Yeah.
Clearly you haven't done surgeries for a few weeks then. So when you're on the front line like this, what are you doing right now? What are you personally doing when you're getting in to see patients? Are you with them when first meeting them? Or are you with them in the ICU, or where you stand?
Um, so it varies a lot. So elective surgeries certainly have stopped,
Hmm.
and yet emergencies still happen, right? So um, people still get into car accidents. People still end up needing their appendix taken out. People still get cancers that are very urgent and time sensitive to take care of. So those types of things are still happening. And we still need to be able to take care of all of the normal healthcare that needs to happen, right? The pediatricians talk about wanting to bring in kids for their immunizations because they don't want a measles outbreak in the middle of the COVID pandemic. Right? You have to balance the risks and benefits of what do you need to do to, on a preventative side and also on a therapeutic side, while not exposing people unnecessarily to COVID risks. So there's a lot of back end work on trying to decide what types of problems are we still going to treat? What types of patients are we going to reach out to make sure that they're still getting the care that they need? And also, how are they going to get it and where are they going to get it? There are some specialty specific changes. So ENT turns out is one of the highest risk specialties for COVID, right? Everything that we do is right in front of somebody's nose and face. A lot of the procedures that we do cause people to cough or sneeze or gag, and getting a face full of spit in this context is certainly more dangerous than it normally is. And there are case reports all over the world of otolaryngologists or ENT doctors getting very sick in a much higher percentage than most other even medical professions. So part of what we've done as a group or a group of otolaryngologists is to completely revamp how we protect ourselves for the procedures that still need to happen, but also come up with guidelines that are not just based on fear and anxiety, but as much evidence-based as possible. So all of that work in the ENT world across the country and really internationally is also very time consuming. So that's very specific for ENT, but it's how do we manage patients in the ICU, in the hospital, in the office, and even at home while working in a very high risk specialty.
Now, how many patients are you guys averaging in the ICU right now?
So Cedars-Sinai is very protective of that kind of information. I
Okay.
can give you an idea that from mid-March till now, there was a steady march up in volume, but it was linear, it wasn't exponential. And really over the past week and a half, 2 weeks, it's actually kind of flattened out a good bit. So everybody's kind of waited with bated breath for a potential surge. And we don't know if it's still going to come or not, but I don't think anybody at this point expects us to be anywhere near New York. Cedars is an 886 bed hospital. So we're a huge facility in the middle of LA. And with the call from the governor's office of increasing our capacity by 40%, we're really preparing for a hospital census that's well over 1,000. And right now we're nowhere near that. We have a lot of extra capacity of empty hospital beds sitting there waiting, ICU beds, ventilators, and staff just ready. So we're confident that we're going to be able to meet the demands of our community. And I don't want to jinx myself either, and so knock on wood.
That's such good news. And you feel like you all have all the PPE and everything that you need, and you're in good shape and just in case.
I think the rational side of me says yes, and then there's always that kind of visceral side of you never feel like you have enough protection, right? There's still a certain comfort in the hazmat suit, but the reality is that's not readily available and doesn't seem to be what's necessary. And so I think every frontline practitioner is trying to juggle how do we keep ourselves and our family safe while being able to take care of patients. And part of that is being, I guess, what's the word, reasonable with the equipment and supplies that you're consuming, right? So if I put on the full hazmat suit for somebody who's super low risk and I'm not doing anything that's aerosolizing, it's overkill. It might be helping me with my fear and anxiety and paranoia, but it's also taking that away from somebody who may truly need it. So balancing those things, but that aside, everybody is trying to be very conservative about not unnecessarily using up PPE. And as long as we continue to be thoughtful about it, we're fine.
Great. What do you think people are going to learn, or y'all are learning, or the world in general is going to learn from this outbreak as opposed to some of the previous ones, the swine flu, Ebola, some of the things that clearly did not make this kind of impact or this necessity to shut the country down?
Well, I think one of the big learnings is we have to be much more aware of our supply chains, right? So not just of how much we have, but where it's coming from if we end up needing more, right? So to be that dependent on China, where Wuhan was the epicenter or where things started, and also happens to make a huge chunk of the world's masks, right? And having that double whammy, we really need to have more resources available in a broader kind of geographic diversity to be able to get what we need. I think within healthcare facilities, for sure, handshaking should probably never come back, right? It just doesn't make sense. And in the past, it was always, poo-pooing that of you're being overly paranoid. But now, in the new normal, I don't know that it makes sense to bring that back to the healthcare environment. I think there are going to be a lot of good changes to healthcare, right? There's been a very slow adoption of video visits and telehealth and kind of non-traditional, non-face-to-face forms of outreach and communication. Everybody that I know is doing 80-90% of their visits through telehealth. Now, it's not a perfect replacement for face-to-face, right? Especially in ENT. I cannot look in somebody's ear or nose or throat all that well over video. And I'm sure you can imagine some other body parts that you may not want to throw up onto a screen. But even if it's not a perfect comparison, it still allows you to do a lot that you wouldn't have been able to do before, right? So those are just some examples. I worry about all of my colleagues in private practice, and if private practice really is gonna, we've been talking about it forever that private practice is dwindling. This might be the death knell for the vast majority of private practices out there. A lot of health systems work on very thin operating margins to begin with, so it'll be interesting to see what happens with a lot of healthcare systems overall. A lot are not as fortunate as Cedars as, so, you know, we'll see, but healthcare is going to look wildly different, both in the delivery of care and the kind of face-to-face doctor-patient side of things, but also kind of health system in the structure.
Let me ask you, there's been a lot of talk and chatter, of course, on all the news channels. You can't turn on a news channel without hearing different theories, ideas. Have you heard much that you would consider myths more than fact?
I'll try not to get too political with this, but certainly a lot of people will hear about, you know, some experience that one individual had, or, hey, these 6 patients did this and it turned out better. I think people are really scrambling and searching for any little ray of hope on how things might be managed in a more proactive way, right? People are not comfortable with the, you get sick, we're just going to watch and see how it goes, or we give you some oxygen and give you some support. People want to feel like there's that quick fix or that miracle cure or that thing that guaranteed will help. And I don't know that we can say with any sort of certainty that any of these anecdotal things work. It doesn't mean we don't try them, but we have to be very intentional about what are the right patients, what are the right circumstances, what are the right environments in which to do it. So Cedars is involved in, I lost track. I mean, I think there's probably well over 20 or so different investigational studies in all things COVID related, to really try to help manage our patients better, but also inform kind of the ongoing response. But we can't react to every, you know, 1 patient, 5 patient story, I guess.
Sure, that makes sense. So let me ask you, this is kind of just hypothetical. So if a year or 2 ago you would have had a crystal ball and been able to say, oh my gosh, this is coming, or maybe better, you would have been Bill Gates and predicted it 5 years ago. What would you have done personally, professionally to prepare for something like this?
Right. So, I mean, if you look at that TED Talk from, I guess, 5 years ago, I mean, a lot of the bigger picture of what should have been done or what could have been done was laid out very clearly, right? I think on a personal level and a health system level, there's always that hindsight, you wish you could do more, right? So without going back years, I would just go back even to December, January, when reports started coming out of China. It would have been nice to, even just on an ENT level, be better informed of what's happening to the otolaryngologists out there, to know a little bit earlier that, hey, we are a high-risk specialty, and what are some of the things that we could investigate or look into and study, and what are some precautions that we want to take. From a health system standpoint, I think even though I made the comment of we're doing okay on PPE, it would have been nice to have bigger stockpiles before. We have a lot of different strategies on how to be very cautious about how and when we use it. How do we extend the use of certain things? How do we reprocess things that, honestly, if we had an unlimited supply, they would be single use and tossed, right? So just kind of, if we were much further ahead of the game and able to order everything that we needed in anticipation, it would have been nice. Thankfully for us in LA, it didn't end up being, or doesn't seem like it's going to end up being a huge problem. But if you look at New York, I mean, they would have loved to had a few more months to prepare.
Yeah, had it turned out that the rates would have been anywhere near what New York City was, I'm sure it would have put you all in just as bad of a situation.
Right, right. Um, what has been amazing to see across, really, not just medicine but everywhere, is that everyone's coming together to really, as communities, help each other out. Right? You hear about not just all the people kind of donating their time, trying to scramble and come up with masks on their own and donate to hospitals, to offer to go grocery shopping for the elderly neighbor who's high risk and shouldn't be leaving the home. I mean, there's so many examples of people really coming together in this time that have been very inspiring.
What is the hardest part about being a doctor in this situation right now? Not a leader, but as a doctor.
Um, I think there are a couple of things. So one is that certainly as surgeons, when we see a problem, we're very used to charging in, doing something quickly, and it's fixed, right? And for COVID, that's definitely not the case, right? Going back to the earlier comment, you're really a bystander, right? You can make sure that they get enough oxygen. You can make sure that they get the medical support that they need, but really you're helping their immune system fight the bug. You're giving their body the resources to help, but there's nothing that you can actually do, in the sense that it's not, you're taking out a tonsil, right? You're not straightening a septum. You don't get that instant gratification. So as a surgical specialist, that's certainly a little bit difficult. I think for me, a big component too is really, if I get exposed, I've kind of reconciled my kind of personal risk and personal health in the care for COVID patients. But the possibility that I am the vector to my loved ones is something that certainly in my generation, we've had the luxury in the US of not really having to think about. I kind of worked around that a little bit by isolating myself in an apartment, but that also is emotionally and psychologically tough in a different way. But at least, again, I didn't feel like I was the source of potential infection, right?
Sure.
And the other part, I guess, that I struggle with currently is LA isn't hit that hard right now. And I'm starting to feel like we will continue to see a rise in kind of COVID volume and COVID patients. I think it's going to be more of a marathon than a sprint. I think it's going to continue to drag on. Like when we flatten the curve, it does go on longer. And that's good because the system isn't ever getting overwhelmed and the resources don't get overwhelmed. But as long as things are under control, at what point do we help out people in areas that really do need it, right? How do we redeploy not just resources and supplies, but even people to areas that really are overrun? But I don't want to, let's say, abandon my post here when things still could happen here that we don't truly know if and when the peak is going to hit.
Sure. Wow, this is a whole different world. Hard to even believe that it's come to something like this. It's just such an unusual circumstance that I certainly never foresaw. I don't know anybody could have, but one of the things I was gonna, just to shift gears a little bit, obviously, we recruit,
Mhm.
and we're going to be, we're actually, our recruiters are still busy. They're talking to more physicians than they probably ever do. We're
Mhm.
having so many doctors call in and talk. So it just makes me wonder, though, on the flip side, how long it's going to take to say, is it going to take to get back to normalcy? Once we say, okay, we're past this emergent situation, it's business as usual, or do you think that the medical staff plans and things like that are going to go back to what they were? Or do you think there's going to be an adjustment period to where people can say, we've got to get our volumes back, we've got to get electives back, we've got to get ourselves a better financial capital position? What are your thoughts on that?
I think it's going to be highly variable. There are absolutely going to be certain positions that have uh, been approved already, budgeted for, and hugely impactful from a let's say current deficit or need, or a huge market opportunity. And those, obviously going to take first priority and probably the easiest to continue to move forward with. Where things might start to um, fall behind a little bit are more of the, well, it's not a critical need, but it's something we were thinking about.
Mhm.
Where in the past, you might have enough bandwidth and enough working capital to say, well, yes, let's give it a try. Right? Those positions are probably going to be delayed or put off a little bit. Um, a lot of health systems and medical groups, though, are struggling. Right? It's still, as much as we try to provide kind of value-based care, a lot of uh, revenues to most health systems is still very much fee for service. And if you stop elective surgeries, that's a huge part of the income that comes into any sort of healthcare organization. And when you switch over to video visits and telehealth, there are reimbursements for them, but they don't come close to matching what we had to stop. And again, some places are going to be able to weather that better than others. But we have already seen some, just to get through the current state, have had to either furlough a bunch of people, and that includes some physicians or certainly allied health. Other organizations have opted for, instead of furloughing or laying off people, a haircut across the top. So everybody loses a certain percentage of their guarantee or their income. Um, we haven't had to do either of those. We've made the decision to keep everyone whole. At the same time, that can't last forever either, right? At some point, um, as this continues to drag on, we have to find a way to make the financials work. And that certainly may delay some of the hiring that is going to be ongoing. So it really depends on where you are, how you're doing as a group, what kind of positions we're talking about. But I have a feeling that there is going to be a little bit of slowdown in some of the more uh, longer term kind of development and growth positions.
And as the leader of your group, I know that as a physician, you're always, as you said, going to jump in 100%, do whatever you can, take care of your patients, et cetera. But as a leader of the group, it seems as though you may be caught in a tough position because you're always fiscally responsible and you're trying to make sure the group gets through to the other side. But there's probably only, I assume there's only so much you can do.
Right, and so some areas we've, I guess, had a little bit more success than others. So I'll use our gastroenterology group. So colonoscopies aren't happening, right? At least the screening ones, all the non-urgent GI procedures. And so that's carved out a lot of, we'll call it free time on their hands. And they've doubled down and spent a lot of time connecting with patients in video visits. And so if you look at their volumes on the office visit side or the video visit side, it's actually through the roof. It's a lot higher than it used to be. What you've swapped out though is you're not doing any scopes, right? But at least they're busy doing something. In ENT, we haven't had that as great a success with that because again, there's only so much we can do without sticking a scope in somebody's nose or really looking in their ear or doing hearing tests. So certain specialties lend themselves to being able to ramp up and stay busy in this kind of environment better than others. And if you go specialty by specialty, and again, there's wide variation, but in the aggregate, we're not going to be as busy as we used to be. We're not going to ever be able to replace the procedural volumes and incomes with even just kind of office visits and video visits. But the more we do, the more we maintain the relationships with our patients, the more we do our best to help them manage their chronic conditions. Then when things start to open up again, I think, we'll obviously have a huge backlog of things to catch up on. But yeah, it is a balance. It is a struggle.
So I know you've mentioned a couple things, but only got a couple more questions for you. But what do you think the lasting effects will be on healthcare as a result of this? The longest, again, back to kind of lessons learned, but the lasting effects that this will have on us.
Well, a lot of the short-term changes are obvious. I think we are, as are a lot of places, really starting to think about what do we want the future of healthcare to look like. So one of my operations managers yesterday used a great analogy. So imagine that your house burned down. Are you going to build the same house again, or are you going to build your dream house? And what does that look like? And I think everyone's dream house is going to look a little bit different, and there are pros and cons to every decision that you make. But I think this is an inflection point where we really do have a rare opportunity to make significant change. So we've talked about, it seems like for the last 10 years, how frontline healthcare providers are at high risk for burnout. And a lot of it was centered around clunky documentation requirements and the electronic record, a loss of autonomy, perhaps feeling like you're on a big treadmill and a loss of purpose. And in these few weeks, a lot of those things have changed. And the question becomes, as we move forward, how much of the good changes can we keep? So the fact that it's a lot easier now to do video visits, a lot of the regulatory and compliance and documentation issues have been loosened up to allow for care delivery at this time. I think they're going to have a hard time like clamping back down and putting that back to the way it used to be. I think this has given a lot of providers a renewed sense of mission and purpose that may have been missing a little bit in the day-to-day grind, and a better sense of community and being together. I think that sentiment will continue hopefully for a long time. I mean, that's not so much of a tangible what to do, but I do think it's going to make a big difference in how we are as professionals and as a profession moving forward. I think for they'll call it the healthcare system more broadly, healthcare policy, those are obviously much bigger questions that I think we can kind of deal with in our little Zoom meeting here. But looking forward to kind of the bigger structural changes. One example is as people lose their jobs, right, they also lose insurance. That's a problem. We got to figure out how to fix that, right? Um, a lot of doctors and nurses and PAs and NPs are either getting their pay cut or getting furloughed right when we need them to really put their own lives and livelihood on the line. Um, that seems like a really bad disconnect, right? Um, so those are all things that I think we absolutely need to find a solution for, and what we want that dream house to look like. But I think it's really highlighted that the current structure really needs to be redone.
Yeah, that's a great answer. And last question is, I hear so many people, lay people that are out there saying, I can't be on the front lines. I can't, I'm not, I want to do something to help. What could I be doing? What would you say to the general lay person who's saying, what can I do to help you over at Cedars-Sinai? Or what can I do to help people on the front line at this point?
Well, number one, first and foremost, is this isn't a hoax, it's real, right? So kind of really take it seriously. I know it's hugely inconvenient to have to stay at home. I know people still want to be able to go out and have more interaction. The areas that I think have done well are the ones who took it seriously, locked down, really did the social distancing or stay at home. And for huge swaths of the country, their anticipated peak is still to come. So even if it's not obviously overrunning your particular county or municipality, take it seriously, listen to the experts, really be careful. Because if you do it right, it's going to feel like it was a whole lot of nothing, right? And that's great. We want it that way. We want it to be underwhelming. I want to say the 6 feet distance recommendations, that's a minimum safe distance. It's not, hey, if you're 6 feet away, you're okay. That's like the minimum recommendation. The idea is if you don't need to go somewhere, don't go somewhere. I still occasionally see people, playing basketball on the basketball court and everybody's sweating over the same ball and bumping into each other. Or going for a jog is nice, but if you're jogging behind somebody, I mean, everything they're breathing out is kind of going back and you're taking it in. You still need to be careful, even if you are outside, even if you are 6 feet away from somebody, even if you do have a mask. So really it's stay home as much as possible, only go out for essentials, wear a mask, stay at least 6 feet apart from other people. I think that's the biggest thing that you can do, because if you never get sick or never get your loved one sick and never end up in the hospital, that's the biggest help you can give any healthcare provider. The second is, if you wear a mask, don't touch it all the time, don't fuss with it, don't kind of pull it down over your nose. As a surgeon, it drives me nuts when I see people using these in the incorrect way. For a vast majority of people, if you have an N95 mask, give it to somebody in healthcare who really needs it, because almost everyone who's wearing it out in the community is wearing it wrong. They don't have a good seal. If you're using it correctly, it's uncomfortable. It gets hot. It gets humid. And so people don't wear it that way. Then you might as well be wearing a cloth mask at that point. Give that to somebody who really needs it. And gloves are a great idea, but gloves don't replace hand washing. I mean, I see people touch a door handle, then their glasses, then their keys, then their cell phone. Well, I don't know what you expect the glove to be doing for you at that point. You're still better off, when you touch something, wash your hands, Purell. To give you an idea, I guess, my parents. So I do sometimes wear a glove when I'm going from the car to the elevator, but I almost walk around with it like this. I touch the button and it's almost like this contaminated appendage. And then I have my other one to touch my phones and my cell. And or my keys and everything else. And eventually, you toss the glove. Really just hand washing is super critical. Gloves don't save you from that. Social distancing and not going out when you don't have to is much better than wearing a mask and still going out as if nothing's happening.
Well, listen, I so much appreciate your time, and I can't wait till we can all get together again and maybe grab a round of golf or something. That'd be a little more fun.
Yeah, sounds great. I look forward to it.
All right. Thanks so much, Gene.
All right. Thank you.